with us right now. So let's talk a little bit about this. We have a death in our area, and we have a number of people who are sick with coronavirus. How concerned should we be?
You know, I think the most important message is not to panic. I think it's very important for us to be prepared and really to stay on top of the most current information that's coming out, because it really is changing every single day.
It seems to be. If people are sick or feel like they have the symptoms of coronavirus, we should point out that these symptoms are the symptoms similar to a lot of viruses. What should you do?
That's right. I think one of the really difficult things is that it can be very tough to distinguish this from other viruses. If you have mild or moderate symptoms or think you may possibly have coronavirus, we can't stress this enough. Do not rush to urgent care or the ER where you might spread it to other people. Call your doctor or call an emergency room and find out how you can get tested. If you have severe symptoms or truly need medical attention, it's always fine to seek care, but let them know immediately that you think you may have coronavirus.
If you walk around Seattle right now, maybe hop on an airplane, you see a lot of people with masks on. Yeah. How important is that? Is that really a good idea to wear a mask?
You know, currently the CDC and the WHO are recommending masks only if you have symptoms of something and not if you're well. So we will update those recommendations if they change, but currently we don't think there's a benefit to everybody going around wearing a mask.
It's important to point out here that the flu kills far more people than we've seen with this current virus right now. As we see this kind of move forward, this virus spread, how concerned should we be about that and the deadly nature of viruses?
You know, I think the unknown is always scarier than the known. And so flu is something that we deal with year after year. We think that the mortality rate for this novel coronavirus is about on par with a severe flu year, but it's new and it's changing rapidly. And so I think that it's very difficult to make those predictions in terms of what will happen in the near future.
I know they're trying to come up with a vaccine, but that's a while in the future. Meantime, this virus begins to spread. Are you surprised by how quickly it's spreading?
I'm not, actually. I mean, I think that many of us in the medical fields were sort of predicting that we were anticipating seeing more cases here in the U.S. The new thing that we have is now this community spread, so people who haven't traveled or had close contact with someone who has, and that's something that I think could potentially spread much more quickly.
The fact of our proximity to Asia here in Washington State, does that make it a little more risky for us? Do you expect it to spread a little more here than we might see it in other parts of the country?
Yeah, you know, I think that's an interesting question. We certainly have much more travel back and forth to Asia and to China in particular in this part of the country, so I'm not surprised that we've had some of the first cases. But now that it's in so many different countries in the world and we're having community spread in some of those countries, I think it's potential that it could pop up anywhere.
It's certainly something we're all thinking about these days. Is there any message you'd like to send to the people right now watching this that you think is most important?
Again, I think it's really important to remember that 80% of people who get this virus will have just mild symptoms that will feel like a cold. The mortality rate, again, is only reported at 1.5 to 2%, and we think it may actually be lower than that once we start testing more people. But if you have it, again, the most important thing is not to spread it to other people and to get tested right away so that you can quarantine yourself if you're positive.
And when you talk about the mild nature of this, there may be people who have had coronavirus at home, not even know they've been exposed to it.
Absolutely. Yeah, I think the majority of people wouldn't necessarily know that they had it if they had only mild symptoms. I also want to say that we're seeing very few cases in children, which is a good thing. So unlike many viruses, we're actually not seeing so many cases in young kids.
All right. We appreciate your perspective. It's great having a professional here who truly knows what you're talking about. Thank you very much, Dr.
You're welcome.
Meade. Appreciate it.